Top two options for weight loss. There is medical weight loss, which includes prescription medications, and surgical weight loss or bariatric surgery. There are significant differences between medical weight loss and surgical weight loss. These days, under medical weight loss, most of the medical weight loss medications used are the GLP-1 agonists. There have been a lot of studies comparing the GLP-1 agonist or medical weight loss with surgical weight loss or bariatric surgery. I think a key difference, in my opinion, that it comes down to is changing your physiology. We've had medications often come on the market and go off the market for various reasons of patient safety, not being effective, or inability to take the medications for the long term. Anything that occurs in a patient to cause weight loss has to be a permanent change to that patient. Anything that is considered temporary usually will not lead to a permanent or durable or sustained weight loss. The most important thing with weight loss is that it's got to be permanent. A patient can lose weight, say they lose 40 or 50 pounds, and then they regain the weight, say 60 pounds, and then they lose 40 or 50 again. Well, if you go over about a 10 or 20 year period, in the end, they're up a little bit or about even. Well, it doesn't even matter how much they lost in between the starting point and the end point. Their body still has the effects of that weight, and the net effect of that extra weight is other illnesses or conditions, what they call comorbidities, which would be diabetes, hypertension, and all the other organ damage which goes with having that weight on your body. So the issue with medical weight loss is that the weight loss may not be sustained or permanent. We've done studies to compare medical weight loss and surgical weight loss. A recent study where they looked at over 40,000 patients involved in multiple studies had interesting findings comparing the GLP-1 agonist to surgery. What they found was with the medications, you lose about half the amount of weight you would generally lose with surgery. You lose about 10 or say 15% of your excess weight with the weight loss medications, GLP-1 agonists, compared to surgery where you lose about 30% of your excess weight. They also looked at, okay, well, what about your regain rate after you've had surgery versus the medications? We've got multiple studies looking at bariatric surgery and the long-term effects on weight loss. On average, there was about a 30% total weight loss, and over about a 10-year period, patients kept about 25% total weight loss for their permanent or net change in the amount of weight lost. Medication-wise, at about 1 year of the GLP-1 agonist and stopping the medication, over 50% of patients regained the weight. It all comes down to what we call the set point theory. And this, in my opinion, comes down to why weight loss surgery will always be important in treating obesity. The set point theory is a very basic way of saying that a human body, an adult person, has a certain set point where your body wants to be, the weight that it wants to be set at. And as you age, that tends to go up slightly, but it is a certain weight that you live at that you may go down or up, but in general, it gyrates around a certain point, which is what we call your set point. It's very difficult to move that set point, which is why diets without any kind of medication help really don't work. And it's because your body, say you lose 50, 60 pounds on your own, it doesn't forget where that set point was. So if you were at, for example, 300 pounds and you got down to 250 pounds, your body wouldn't forget that 300-pound mark, and it would work really hard to get back to that. That's why it's challenging to help obese patients without something like surgery, is because they're fighting a natural drive in their body to reach that target. And what this all comes down to is several factors. There's behavioral factors, there's genetic factors, cultural factors, physiologic factors. So there's multiple factors, not just one factor that causes a patient to arrive at that set point. And that's why treating obesity has got to be multifactorial. It can't be one solution. It's got to be every aspect of a patient's life to permit permanent weight loss. The reason surgery is so successful is that surgery changes your physiology. It truly changes your anatomy. And so by changing your anatomy, we think it changes that set point to a lower level where your body's happy at a different weight. So instead of your body being comfortable at this weight, it lowers your body down to a new target weight or set point. And at that set point is now where your body's comfortable. When you lose it on your own, you tend to be hungry and want to eat, and eventually you give in and you regain the weight. With surgery, you lose it, you hit that new set point, and then your body tends to be at that set point, and that's your new place to be, and you tend to be not hungry all the time like you would imagine after losing it without having surgery. This all comes back to the anatomy. Basically, your body's relation to its stomach. I think the stomach as an organ is what, in my opinion, sets that set point. There's a lot of hormonal influences in your body, but any operation that we do for weight loss involves changing the anatomy of the stomach. And that can be either by bypassing the stomach or removing a portion of it, say a sleeve gastrectomy where you remove 70% of the stomach, or a banding, which we really don't do anymore, but that also was placed on the stomach to give a restrictive feeling. So it all comes down to changing your physiology by changing your anatomy involving your stomach. To find out more how bariatric surgery can help, please subscribe to our channel for more information.